In part 1, we did all the tests and finished with this message telling us PrevMed would reach out and schedule an appointment with a health coach. I assumed I would be assigned a health coach of some kind or possibly a nurse practitioner. Imagine my surprise when he assigned me to Dr. Meza, or Bernie is how he introduced himself. I can't tell you how incredibly refreshing it was to talk to a doctor that actually understood metabolic health, was perfectly in sync with what I needed, and who placed lifestyle, diet, and exercise ahead of drugs. He went over the final report with me in clear, simple language and provided guidance on how to move forward. In this video, we'll go over those results and his feedback. And I also can't emphasize how incredible it is that they offer both the kit and the doctor's feedback for only $169. That's crazy. Now, it's important to understand this Metabolic Risk Assessment Kit is really intended for someone starting their metabolic journey that knows nothing about where they stand. It's a quick and easy way to figure out where to start. It's not intended to be a detailed, comprehensive analysis of everything under the sun. Now, I've been working on my metabolic health for several years now, so I'm pretty far past that point. But just having dedicated time with a professional that understands metabolic health is worth every penny. Before even starting the results, Dr. Meza asked me about my background, how I got into this, and where I stand on lifestyle, diet, and exercise. It was awesome to talk to a doctor that actually understands how fundamentally important these things are to any diagnosis. We then moved on to blood pressure, which, if you recall, wasn't part of the testing, but I added it anyway. He told me that was definitely an oversight, and then we spent quite a bit of time talking about blood pressure. He likes to see blood pressure never going over 130/80. Now, before I started my metabolic journey, my blood pressure was all over the place, even up to the 160s/110s, but averaging around 145/95. And that was while I was taking multiple blood pressure medications. Within a couple weeks of changing my diet to low carb and only eating ancestrally appropriate whole foods, my blood pressure dropped so radically that they had to take me off all blood pressure medications. Currently, my blood pressure looks like this and averages around 124/75. Again, simply because of diet. Nothing else changed. I'm thrilled with that, but Dr. Meza encouraged me to keep working on it and to try and get all readings below 130/80. According to him, the more time spent above 130/80, the more damage you do to your arteries. Now, are you going to have some super stressful days that'll push it over the line? Of course. But clearly I have a little work to do to get these even better, especially since I'm high risk with my history of multiple heart attacks and stents. Dr. Meza then talked about how Lp(a) and the APOE gene mutations can influence blood pressure. He prefers Lp(a) to be below 40. I happen to have mine tested and it came back as 14, so I'm in good shape there. I do need to look into that APOE gene mutation stuff though. He also suggested looking at some of the natural supplements that can help with blood pressure, like Citrulline or Arginine. And Dr. Brewer has a number of videos that show you all the different ways you can lower your blood pressure naturally. I guess I need to go revisit some of those. Dr. Meza did mention that there are blood pressure meds that work really well, but strongly encouraged me to try the lifestyle, diet, exercise, and natural methods first, and use the prescriptions as a last resort. I'm going to keep an eye on this, but honestly, I'm not a big fan of the way the medical establishment focuses on fixing numbers over fixing metabolic health. And since my metabolic health is in pretty good shape, I'm questioning how much I need to worry about this, especially since some groups like the American Academy of Family Practitioners still use 140/90 as their reference. They do point out that while lowering to the 130/80 Dr. Meza recommends doesn't improve mortality, it does appear to reduce cardiac events. I also see where the JNC8 recommends less than 150/100, specifically for folks over 60 based on its benefits versus risk analysis. I need to learn more about that. Also, check out Dr. Brewer's How to Measure Blood Pressure video. You'll be amazed at what a difference measuring your blood pressure correctly makes. Dr. Ken Berry also has an excellent video on measuring blood pressure. Remember, blood pressure wasn't part of the test we did, but they should have been. Okay, now we can start to look at the test results that were part of the assessment. You'll get a report that congratulates you, explains what a risk score is, and how it's categorized into 3 levels. Again, this was all about getting a general feel for where you are and what direction you need to head in. So the scores are intentionally generalized into high, medium, and low risk. It's also mentioned that while there are 7 categories, each one is weighted differently. For example, lifestyle has a bigger impact on overall risk than family history. My metabolic risk level was ranked as high. Let's find out why. My family history is rated at moderate risk. I think mostly because I checked the obesity and lipidemia boxes. Remember, those were very open-ended questions with no real definition of what qualifies for obesity or lipidemia in my family's history, so I just checked the worst case. So I'm not real concerned about this section. My personal history was rated high risk because I'm older, have a history of high blood pressure, I had abnormal triglycerides and cholesterol in the past, I have a history of arterial plaque and heart stents, and I have an autoimmune disease, Hashimoto's. Remember, this metabolic risk assessment is intended for folks just starting their metabolic journey. It doesn't take into account that I've already taken care of most of these things, so of course it's going to consider me high risk. Lifestyle is rated as low risk because I exercise and have a healthy, active daily routine, eat a low-carb diet, don't consume sugar drinks or alcohol, resolve my sleep apnea, and don't smoke. If I had answered all these questions back when I started my metabolic journey, this would have been a totally different result. Oral glucose tolerance test, or OGTT. This is rated as a moderate risk, and I disagree with this assessment. In part 1, we measured my fasting blood glucose, drank 75 grams of a glucose solution, and then recorded how my blood glucose levels responded over 2 hours. Normally, we expect to see a fasting blood glucose under 95, the peak glucose never exceeding 140, and a glucose level getting back under 100 within 2 hours. Why? Because that tells us the body is storing enough insulin and producing insulin fast enough to handle the glucose spike. Insulin tells the cells to get the glucose out of the bloodstream and use that glucose for energy or to store it as fat. Getting the fasting glucose reading is important because consistently high levels of glucose in the blood damages the arteries. So your body prioritizes getting the glucose out of the bloodstream as fast as possible. If the peak we measure gets too high, well, that tells us that the body doesn't have enough stored insulin to react quickly. And if it takes a long time to get the glucose level back to normal, then the body isn't producing insulin fast enough. If the spike is high and it takes a long time to recover, well, then it's not doing either very well. There's a lot we can infer from the simple abbreviated 2-hour OGT test that tells us how well our body handles glucose. When the body loses its ability to handle glucose, you have type 2 diabetes, which means you have high levels of glucose in the blood all the time, which is very inflammatory and damaging to the arteries. And that leads to all kinds of issues. Pretty much every chronic disease out there can be traced back to issues of dealing with high levels of glucose in the bloodstream, which is type 2 diabetes. For reference, fasting glucose above 100 is pre-diabetic, and fasting glucose levels above 125 makes you a diabetic. This chart, which came from the CDC, also shows us the HbA1c cutoffs and the OGTT levels that we'll be using here. So seeing how your body handles glucose spikes is really important to know. I think it's great that PrevMed uses this abbreviated 2-hour version of the OGTT to keep things simple for you while still getting enough information to see where you stand. The original non-abbreviated test takes 4 hours, collects more measurements, and most importantly, measures insulin levels along with the glucose levels. That's called an OGTT with insulin survey, and gives you extreme clarity on how your body truly reacts to glucose events. It's also referred to as a Kraft insulin survey. I'm working on some videos doing a deep dive on this topic that also show you how to test yourself very inexpensively. I'll post those in the description below when they're live. Subscribe to the channel so you get notified when they're available. Okay, enough background. Here's a plot of my results. The issue the report is having is that my fasting glucose is above 95, just barely, and my peak is above 140. It did like that my 2-hour level was well below 100. The fasting glucose is falsely high because I did this test shortly after getting up in the morning. You can see I started this test at 4 a.m. And the body normally raises the glucose level when you first get up to help you get your day started. It's called the dawn effect. Now I wear a continuous glucose monitor, so I took that CGM data and overlaid it here. As you can see, my fasting blood glucose is normally in the low 80s. So we really can't take the fasting blood glucose reading I got in part 1 seriously. The peak glucose is a different story. Yes, if your body's used to consuming carbs and used to producing the insulin required to handle the resulting glucose spikes caused by the carbs, then you would expect a lower glucose spike. Why? Because the body has lots of insulin on hand, ready to go at a moment's notice. My body isn't used to consuming carbs. I average under 20 grams a day. Most people consume over 300 grams a day. So my body does what the body does best. It senses that I don't have much need for insulin, so it adapts and produces and stores less insulin. Your body's very efficient. It doesn't waste energy or resources on things it doesn't need. In fact, if we look at my CGM readings of the 3 months prior to doing this test, you can see in general, my glucose readings hang right around the low 80s all day long, which is perfect. You don't see the typical daily breakfast, lunch, and dinner glucose spikes because I don't consume carbs. The spikes you see are a family reunion at the beach. I ate a lot of crap that week. Ate some cookies here. Had a large bowl of fruit here. A birthday party here. And this OGTT. Insulin release is done in 2 phases. Phase 1 is the release of insulin that was stored in the pancreas so it can react quickly to sudden glucose spikes while it ramps up production of new insulin for the phase 2 release. Because of the low-carb diet, my body sees no need to keep a lot of insulin on hand. So when it does get hit with a large glucose spike, it isn't as prepared to deal with it, so of course we get a bigger than expected glucose spike while the insulin catches up. The good news is we can see my pancreas can produce plenty of insulin when it needs to because of how fast the glucose drops back to normal. Bottom line, I don't like that this test doesn't take into account my diet. If it did, it wouldn't be listed as moderate risk. Now I should point out that this insulin downregulation stuff is a theory I subscribe to. The guys at PrevMed don't believe in this and would simply label me as pre-diabetic. I will be doing more OGTT testing to find out once and for all which is correct. You'll find the results of those tests in the Kraft Insulin Survey videos we mentioned earlier. The Kraft style test is the absolute best way to see how your body handles glucose. It'll tell you if you have problems years or even decades before simple fasting blood glucose or HbA1c tests will. Hit that subscribe button so you'll be notified when those come out. BMI and body fat. If you remember from the first video, we noticed that the body fat calipers weren't used. Dr. Meza confirmed that was intentionally left out. Turns out those calipers, they're too inconsistent. I do think it's an interesting concept, and I'll continue to play with them. So this section relies on age, BMI, and the body measurements we did. This is me when I started all this metabolic stuff a couple years ago, and this is me now. So it's no surprise that this category is rated as low risk. Grip strength came back at moderate risk because they expected a little more. What this doesn't take into account is that I've had multiple surgeries on both of my hands and suffer from joint swelling from osteoarthritis, which limits how hard I can squeeze things. Unfortunately, while grip strength can be a great proxy for overall body strength and fitness, my conditions bias this result too much to make it of much value. But even with that, if you look at their chart on their website, for the right hand, it says I'm smack in the middle of average. Seems pretty good to me, especially given my limitations. Things like carpal tunnel syndrome can also have a big effect on this measurement. But again, the grip strength test is intended to be a quick and easy way to get a rough metabolic risk assessment for most people. And for that, this is a great test. Heart rate recovery. Something went wrong here. A high risk score makes no sense. The goal is to get your heart rate up as high as you can and then see how long it takes to come back down. In particular, you want to see it drop 12 to 18 beats per minute after 60 seconds. How high should you get your heart rate? A good rule of thumb is to take 220 minus your age to get your max heart rate, then take 80% of that for a lower range and 95% of it for an upper range. So for me, that would be 123 to 146 beats per minute. In the previous video, we saw that I got mine to 147, so that's great. And the 60-second resting rate was 108, down 39 points, which is way better than the required 12 to 18. So why is this section rated as high risk when I clearly far exceeded the expected results. I think they might have a boo-boo here. Dr. Meza said he would look into it. The report summarizes that I'm at high risk, which I have mixed feelings about for the reasons we just saw. Yes, I was at high risk, but have come a long ways towards reducing that risk. Am I still at high risk? I don't think so. There are a couple things I would do differently on this report. First, I'd put a summary table at the beginning with links to the various sections. There's a perfect place for it right here. Second, I would put the result at the beginning of each section. It makes more sense and makes me more motivated to read if I know the result first. Third, I would change the font from a gray text to a black text. The gray looks cool, but it's also hard to see. Fourth, there's currently no way to go back and review your original answers. You just get stuck on this page with no way out. It'd be great if you got a summary email after completing the assessment, and if all those numbers appeared again as a summary in the final report. And finally, I would add the standard metabolic rubric, something like this. Blood pressure, less than 130/80, according to the folks at PrevMed, of course. Fasting blood glucose, less than 90. Fasting insulin, less than 10, preferably less than 5, if you happen to have that number available. HDL, greater than 50. Triglycerides, less than 150, preferably less than 100. Waist to height ratio, less than 0.5. If we fill in my numbers, we see I'm doing really well. Know that recent studies tell us that 92% of the population can't pass the majority of these tests. Bottom line, this Metabolic Risk Assessment Kit is definitely worth it, especially if you're just starting out and want to know where you stand and what things you need to focus on. And remember, everything in this kit is reusable, so you can check your progress anytime you want, or even share it with family and friends. You'll eventually need to purchase more glucose test strips, but that brand is available everywhere. My Costco even carries those. And you can get premixed glucose solution for about $3. Just make sure you get the 75-gram version. And my favorite part? Being able to talk directly with a medical professional that fundamentally understands the importance of lifestyle and truly believes that it is the first line of defense towards a better metabolic health. Special shout out to Dr. Meza for being so patient with me. I know he's a busy guy, but he acted like he had all day to help me. Again, what a refreshing experience to have a doctor actually work with me and not hide behind a prescription pad. Now, while I only dealt with him, I suspect that all the folks in this group have the same approach because they were all trained by Dr. Brewer. See the links in the description below to learn more.